Welcome to the Pediatric Respiratory Compromise Skills. These progressive skills are designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to a 1-year-old child in respiratory distress. No other associated injuries are present. This is a non-trauma situation and cervical precautions are not necessary. You must actually perform all assessments and interventions that you feel are necessary. If you choose to ventilate the mannequin with a bag valve mask device, you must do so for at least 1 minute. The preceptor will serve as your trained assistant and will be interacting with you throughout these skills. They will correctly carry out your orders upon your direction. You will be given 2 minutes to check your equipment and prepare whatever you feel is necessary. You respond to a residence for a sick child who is having difficulty breathing. The scene is safe and no hemorrhage or other immediate problem is found. As you enter the residence, you see a 1-year-old child sitting on his mother's lap.
Arrive on the scene with my gloves on. I want to get a general impression of my patient from across the room.
Patient's in respiratory distress.
What's the level of consciousness of the patient?
Anxious.
All right. I approach the patient. Do I hear any sounds or have any indication that I may have any type of airway obstruction?
No.
All right. Patient's in his mother's arms, but I do want to notice how fast is the patient breathing?
28 per minute.
28 times per minute. I want to attach SpO2. What is my reading?
82%.
82%. This time I want to go ahead and apply supplemental oxygen to my patient by using a non-rebreather mask, Pediatric. Attach it to my O2 source. Set it to 12 liters per minute. Attach it to my patient. Now I want to check for a pulse. What's my pulse rate?
104.
Skin color and temp?
Good.
Okay, capillary refill.
Less than 2.
All right. Go ahead and have my partner give me a baseline set of vital signs.
You notice that your patient is beginning to develop decreasing SpO2, decreasing pulse rate, ceasefire respirations, head bobbing, drowsiness.
Okay, patient appears to be going into respiratory failure. I'm going to take the patient from the mother's arms and lay him supine. Go ahead and apply some padding up under the patient. Try and keep his airway open a little bit better. All right. And since he's going into failure, SAPs are dropping. I want to change the non-rebreather over to a bag valve mask. Looking up my BVM. And I'll begin ventilating my patient with the BVM at a rate of 20 times per minute. If the patient ventilates easily, I'll continue to ventilate. If I have any problems, I may put in an oropharyngeal or a nasopharyngeal airway.
You're having some small difficulty.
I am having some small difficulty, so I will go ahead and put in a oropharyngeal airway at this time. Making sure that I have the right size. Using a tongue blade, will insert. Does the patient accept?
No gag reflex.
No gag reflex. Continue to ventilate. Am I getting adequate chest rise?
Yes. How would you know that you're getting adequate ventilations?
I would see equal bilateral and adequate depth of my chest rise. I would see an increase in my SpO2 readings, and I would see a decrease in my end-tidal CO2 readings if I was using capnography. I would also call for an immediate transport of this patient as well.